Lower back pain can have a huge effect on your quality of life. To make sure you get the quickest progress, I want to cover a couple of things when it comes to the muscle flexibility. Now, regardless of when you started feeling the pain, whether it was yesterday, whether it was last week, often what we see is that these conditions actually start months, even years previous. And so we see that a joint will slowly shift into an abnormal position. And what we find is that all the ligaments, all the muscles actually get used to this abnormal position and tighten up around there. So during the first phases of care, we want to look at breaking those postural habits that cause it. And secondary to that, we actually want to look at increasing the flexibility of the muscles around the joint, where what's causing that pain, increasing the flexibility so that when we adjust you, that joint doesn't shift straight back initially. So we actually want to increase the mobility so we reduce the resistance and the pullback motion of the spine and the area affected. I'm going to cover 3 stretches that are absolutely essential to increasing the mobility to make sure you get the best results long term and to actually accelerate your progress. First one is the hamstrings, the second one is the piriformis, and the third one is the hip flexor. This is something that I'm going to encourage you to do at least twice a day during the initial phase of your care, and even when you become pain-free. It's something that you actually want to utilize on a day-to-day basis to make sure that it reduces the chances of relapses. Enjoy. So the first one is the hamstring. I find kneeling down is the best way to isolate that muscle. So from the side, what we want to do is have the leg straight out like this. Now my back is straight up and down. All right, so I'm looking straight ahead. I'm keeping this straight up and down. With that leg straight, I'm actually going to bend forward from the hip joint here. So what you'll find is that when you're in this position, you've got that leg straight, you should only feel the stretch from right at the bottom of the buttock area all the way down here. You shouldn't feel it below the knee and you shouldn't feel it in the lower back at all. And so just holding that position, bending forward and hold. Now what you can also do is you can actually turn the leg out and you can turn the leg in. By doing these 3 stretches, so with the toes up, with the toes out, and the toes in, you'll get all 3 hamstring muscles in between the knee and the buttock area. So the piriformis is a muscle that will tighten right up, especially if you do a lot of driving, and it's situated in this area through here, just in the outside of the buttock area. It's only a small muscle. It can get extremely tight and affect the femoral nerve and really affect the progress of the lower back if it's tight. So to stretch that, often what I'll do is, there's several ways, but I'm going to be stretching the left one. So I'm going to cross my leg and then I'm going to pull it towards the opposite shoulder. And stop. So my hands are on the outside of my knee, pulling in, and where I'm actually feeling that stretch is about that long, right at the bottom of the buttock area. I'm not feeling it up here in the lower back. I'm not feeling it down in the lower leg. Feeling it right in that area as I pull that towards it. And you just want to hold that for at least a minute and relax. The third stretch we're going to cover is the hip flexor. Now this is a muscle deep within the pelvis region, attaches to the front of the spine and then comes down and attaches to the femur. So it can be quite a challenging muscle to stretch, but if you're able to increase the flexibility of this, it will really help with your progress. So from the side on, I'm going to be stretching the left hip flexor muscle. So I'm bringing this leg up. So with this area through here, my hands are up here. I'm lunging forward, and then what I actually do is I squeeze the left buttock area. Now for a guy, often what I'll say, imagine like you're trying to pee over a fence. And that's the best analogy I can use to make sure you get the best out of this stretch. So I'm actually lunging forward, squeezing the buttock area. Now you should feel that deep within that pelvic cavity. So you don't want to be feeling a broad stretch of the stomach. It should be quite isolated within this area. So arms up, lunging forward, squeezing the buttock, and then just holding that stretch. And I can feel that deep within this area through here.